It is the third hour of the Elias Macko Show on this Friday, May 7th. So we're ending off the week and ending off the show. As we kick off the third hour, it's our pleasure to welcome Dr. Don Vinh back onto the program. He's an infectious disease specialist at the MUHC, also a clinician-scientist at their research institute. This is the man with the skills to pay the bills. Dr. Vinh, thanks for coming on the show again.
Hi there, Elias.
Let's get you and everyone else the update. We have the latest numbers from the Quebec government, so let's go through those with you listening and standing by. 919 new cases, and of course that is up day over day, but like I've been saying, we don't look at day over day. We look at the 7-day rolling average, and a week ago I was telling you about 1,041 cases. So the 7-day rolling average, which is now under 1,000, will continue to drop based on the 919 new cases. There are 5 new deaths. However, 2 previous deaths are being removed, not attributable to COVID-19, so a net plus of 3. There are 574 Quebecers in the hospital. That's a decrease of 6. There are 139 people in intensive care. That's a decrease of 5. Now, vaccinations. We set a record, by the way, yesterday. 104,742 were added. 102,000 plus of those were done in the last 24 hours. So a record day for vaccinations in Quebec. And we received, by the way, almost all of the Moderna shipments, 217,000 of the 225,000 expected. So good news on the vaccination front. Dr. Vinh, listen, the reason you're on today is to talk about basically the next steps of this battle, of this COVID-19 battle we're under. And, you know, thankfully it subsided this week. Last week, everyone's talking, oh, it's the variant. Oh, we have to worry about this variant from this country and this variant and this variant. And to me, sometimes, I'll be honest, I feel the coverage of variants is overblown, but I'm just a dumb radio host. What do you think?
Well, I'm not sure you're just a dumb radio host, as you say. I think what you're expressing is exactly what I would feel the same, which is that there are variants, and we'll let the anxiety about the variants in the hands of people like myself and public health and the infectious disease people and the microbiologists. Let us worry about the variants. I want the public to do their part, and I got to tell you, 103,000 of them did their part yesterday, and they got their vaccine, and I want to highly encourage the rest of the public to continue to do the same thing.
So talk about that battle. So it seems to me, and as you just set it up there, it's variant versus vaccination. Why is it there that battle?
Well, you know, it is exactly what you said, variants versus vaccination. So how we're going to win this battle is on several fronts. From the public's perspective, the best thing to do is get your vaccine. In fact, there's some really great data that's coming out that's showing all the vaccines that we're currently using. The Pfizer, the Moderna, the AstraZeneca, those vaccines are actually 70% plus effective against these variants that are circulating in Quebec, against the UK variant, against the South African variant. So if everybody continues to get their vaccinations, these variants are going to be history, hopefully, within, a few months.
We're with Dr. Don Vinh from the MUHC. Dr. Vinh, you feel free over what I'm about to say. You feel free to cut in and say, that is wrong, Elias. You don't know what you're talking about. Please cut in if I go off a wrong path, okay?
Yeah.
But here's some of the things, through what I've read, through the experts like you that I've talked about as we move forward here and we talk about variants. This virus, COVID-19, wants to live, wants to survive. And there are a couple ways this thing, the variants, the ways the variants could go. One, it gets more severe, right? So the variants mutates, it gets more severe. But if it gets more severe, people are more likely to know they have it. So then they isolate, they stay out of the way, and the virus has a less likelihood of spreading because people know they have it, they stay out of society, right? Then there's the other way, the variants actually get less severe. They become more like the common cold, and that's, well, they'll spread, but they'll be less severe. Is that accurate? If we look at the paths the variants could go?
Well, so overall, what you're describing is exactly this, what we call homeostasis of pathogens, of human pathogens, right? So bugs that infect humans have to be careful. If they are too dangerous and they kill humans too quickly, that's a dead end also for the bug because there's a shorter time for it to be transmitted to other people. So it's not going to become exquisitely deadly unless it actually has another reservoir, like something like Ebola, for example. Okay. On the other hand, it could actually be sort of it could become a wimp. It could become very weak, but it's not going to become too weak, because if it becomes too weak, then every time it infects a human, that human's immune system will wipe it out, and it also will become obsolete. So what it wants to do, it wants to try to find just the right middle ground where it can, infect people, whether or not the person gets sick, the bug doesn't really care, but it wants to be able to do just enough to be able to live, survive, and then spread. So how we're going to prevent this from becoming a bigger issue is we need to mitigate the spread, and the way to mitigate the spread is with vaccines and public health measures. And if we do that, eventually the bug will have nowhere else to go.
We're with Dr. Don Vinh from the MUHC. Dr. Vinh, let's talk about endgame. And I know you're not a betting man. Maybe you are, but you haven't told me. Let's say you're not a betting man, but how would you bet this plays out? Are you betting on, we're going to need a booster every year for COVID-19? Or do you think the way the variants and the virus progresses, that we'll win this battle in a more definitive way?
So first of all, I actually am not a betting man, but what we have to do is learn from the lessons of the past. It is possible, based on the original SARS virus of several decades ago, that this thing can just burn itself out, and that we never heard about SARS ever again. And maybe that will happen here. Although I'm going to be honest with you, I don't think that that's going to happen. What's going to probably happen, based on the lessons that we learned from the 1918 pandemic flu and what we've seen with coronavirus, the regular cold causing coronaviruses that we see every year, is that this thing may peter out, so that instead of becoming pandemic and causing this massive outbreak, what will happen is that every once in a while, maybe around the winter time or so, you're going to get little outbreaks, like you said, the cold, like the other coronaviruses. It'll become like its cousins, just circulating every once in a while, causing some people to be sick, some other people to be very sick, but most other people are going to just recuperate. And hopefully that's the most likely trajectory that it's going to follow.
And the best way for us to get to that final destination is through vaccinations. Correct, doctor?
The destination is through vaccination, exactly what you said. What we have to do is we have to ride this horrible wave out so that we force the biology of this virus to go from a pandemic, which is a deadly virus that nobody's seen before, to basically a cold type of virus where every once in a while it'll cause some people to be sick, but not too sick and not at a huge scale. And if we can achieve that through right now public health measures, strictly adhering to them, and with vaccination, then the medium-term goal will be that, and then, of course, a return to normalcy.
What do you say to someone, doctor? Maybe you've had to deal with this over the last little while. What are you saying to someone who is duped by wellness bloggers on Instagram and is now vaccine hesitant? What is your case you make?
Don't be vaccine hesitant. I have heard people say, well, it's only 50 to 70% effective. Yes, but so are seatbelts. And seatbelts, we all wear them because we all buy into the fact that if I can be protected half of the time of an accident, I'll take it. It's the same thing with here. If you can be protected 3/4 of the time, I'll take that, right? This is like the scratch and save every time you go into a store and you want to see how much rebate you get. If you're happy at 10%, that's great. The vaccine is going to be much higher than that, and so we should not be hesitant in taking the vaccine.
A message from CJ8800 and the MUHC. Thank you so much, Dr. Vinh, for that. Come back real soon, and thanks for all of your help to us and our listeners.
Thank you, Elias.
That is Dr. Don Vinh, MUHC infectious disease specialist.